Hello, my name's Ryan Roche. Today we're going to be going over the Washington Township Community Paramedic Program for the Mobile Integrated Healthcare class, EMS 4308. So the way this video is going to work is I will direct it slide by slide since I'm not tech savvy enough to be able to show you my screen while I'm looking at it. So I will be calling that out so you can follow along looking through the PowerPoint. Moving on from the cover slide. Why do we need a community paramedic program here at Washington Township? So in 2024, Washington Township Fire Department took over 10,247 calls of service, of which 7,826 were EMS calls. Breaking it down even further, 64% of those EMS calls were for geriatric patients older than 65 years old. So the township as a whole has over 22,000 senior citizens living within the jurisdiction. These residents range widely in living conditions, with some living in one of the 9 nursing homes that we have, some living in assisted living communities, and an even greater portion living independently still in standardized residential plats. So many of these senior citizens do not receive the proper assistance they need to effectively manage their health, and they subsequently call 911 as a result of that. So the abuse of 911 for non-emergent calls in general costs the department money, wears down apparatus through unnecessary wear and tear. If the department could preemptively help our senior citizens with non-emergent medical and health concerns, that in turn would significantly help reduce the call volume that we take. That decrease in calls would also help save the department money and help reduce wear and tear on our frontline apparatus taking those calls. There are plenty of benefits to the creation of this program and the creation of a community paramedic program. So what is the goal of the program? So it is to significantly cut down non-emergent call volume from our senior citizens within the township, help the community get proper health care and meet their basic needs for senior citizens. We're going to leave it contained to just senior citizens for the program right now. Once we can justify our existence and show the positive results that I know this program can make, we'll leave it open for expansion and other patients that are in need. So we want to be a spotlight for our senior citizens in the community who don't know where to turn for assistance. We want to help guide them through the complex healthcare system instead of just having them resort to 911 to solve their issues. And we're also going to help our senior citizens with basic medical needs, such as taking their vitals, maintaining a healthy standard of living, medication administration, and adherence to prescriptions and doctor's orders. Moving on to the next slide, planning. Washington Township Fire Department will hire 2 full-time paramedics to work 40 hours, 0800 to 1600, Monday through Friday during the week to accommodate the senior citizens in the township. These new members will be put through a 2-week orientation to cover specific nursing facilities, senior living, neighborhood plats, hospital coordination, and other associated outreach programs. Next slide. Planning logistics. So the way the program is going to work is we're going to have 2 members assigned to our 2018 Freightliner second line reserve. It's currently unused. We have a rotation of medic units that we rotate throughout the department, and we always have spares. So we're going to be designating one of our reserve units to take over this responsibility. The members will work closely with on-duty crews, Kettering Health Network, Premier Health Network, Meals on Wheels, and a lot of other associated nursing home facilities to accommodate these applicants and members of the program. The unit will be located at Washington Township Fire Department Headquarters, Station 45, 8328 McEwen Road. The unit will be filled with mandatory overtime as needed when the 2 community paramedics are off on sick leave, vacation, trade, whatever. Planning operations. So the unit will be dispatched for low priority geriatric calls that meet certain specific criteria from dispatch. So on-duty crews also can request this unit when appropriate. They can clear the call and return to service, and it basically frees up that frontline medic unit for other calls. The unit will properly be equipped and fitted to allow patient transport to the hospital if necessary. The primary goal of this unit is not to transport patients, but we have that capability. That way we can still transport if needed, not have to call in additional resources. The unit is specifically designed and meant for community paramedicine, but like I said before, it will be allotted to take transports and also 911 emergency calls as well. So with that, a caveat that we're going to be offering to the township is it's going to be an extra medic unit as a last out. So before mutual aid is called with longer response times to our citizens, we can use this resource as well. This is not its primary function and it should not be abused, but we are putting it there so that it can be flexible and still be a widely versatile asset to the department and not just focused on one specific prospect and have longer en route times to our citizens. I also wanted to say that the unit will follow up with the people that sign up for the program on a day-to-day basis. So they'll create schedules and times to show up to assist them. So that way they can get a schedule going when it's not on priority calls or low priority calls, I should say. If a priority call does come out, they can always leave and come back, reschedule within the next day. So we will be setting up procedures to accommodate that. Moving on to the next slide. Proposal. Application of program and training. So the department is proposing we pay a competitive salary for the 2 full-time paramedics that we're going to be using for the community paramedicine program. We're ranging that around $68,000 to $80,000 for top out with applicable insurance and benefits. We want to make sure that we don't skim on salary and hire very qualified and helpful members. We don't want to try and scrape the bottom of the barrel to hire these people. And that means we're going to have to pay. So the assigned medic unit for this project will utilize already available apparatus. That way we don't have to specifically order a new medic unit. So that is also a perk to the township, is we are not taking on an extra vehicle purchase order. We're just using what we already have, making the most of it. The full-time paramedics will be ACLS certified, American Heart Association CPR certified, with an emphasis on home health care classes and a preference for dual certified paramedic nurses, which we can discuss pay raises later in tuition reimbursement. But we will be putting them through training within every year. Proposal total cost. So this is the part that is most important, is their funding. So personnel costs, $180,000. We've allotted for overtime into that in anticipation of mandatoring people to fill in that spot as needed. The initial equipment purchasing, estimated around $25,000. That's to restock, get the medic unit back to complete service ability. Operation costs, we're expecting $10,000 a year between maintenance and fuel for the vehicle. Vested interest with the hospital networks and nursing facilities for some financial reimbursement when applicable. We're estimating that to be around $25,000. So because we're bringing these patients to those health networks and helping save their emergency department beds with these non-emergent low priority calls, we're going to be seeking some financial assistance from them to also help alleviate some of the financial burden the township takes on. We've been in talks with them, so that's very feasible. As an initial cost, the upfront cost to create the program with the first year is $215,000, and then we expect the annual operating costs moving past the first year to drop down to $170,000 to $190,000, keeping in mind that we can get $25,000, $50,000 from our partners to help alleviate that financial burden moving forward. With the 2025 budget, this would require the township to approve additional funding. That way we don't have to make cuts to other project areas within the department. So we are asking for an initial investment before the next budget. So funding. The next slide. This program is not inexpensive and requires consistent, stable funding. We're requesting the township to allocate the upfront $250,000 for the creation and first year of the program. With the recent levy passage, we can accommodate this expense without a financial burden to the township. So it is an ask for the upfront, but I assure the township that if we invest this, we will see our returns and then some within the next couple of years. Not right away. I'm not saying the first couple months, the first 6 months, but the first couple years, you're going to see a return on our investment. So after the first year, we are looking to our local hospital networks to help adjust, again, $25,000, $50,000 per network. So I misspoke earlier. We can actually expect up to around $100,000 if all goes well and we're able to really maximize those partnerships with those health networks. This is feasible from a business, as we'll be bringing them in, and reduction for I already said that, with their 911 valuable bed spaces. The other 50% of that expense for the budget, the $70,000 to $90,000 of funding, will come from the annual fire budget. Again, the results will speak for themselves, and we can definitely accommodate that much money. We will also be applying for grants as needed to help reduce the financial burden even more, to try and maximize the money that we have in the budget. Next slide, evaluations. So quarterly review for expenses to ensure budget compliance. All medic units are going to be tracked for call volume, patient demographics, total call volume, and percentage of non-emergency calls. Will be heavily researched for any changes. The mileage will be taken from the community paramedic unit, as well as call volume. Mileage on the frontline units is already tracked and will be compared after 1 year between what they were taking before and what they're taking now with the community paramedic unit in service, to see the difference in the load that's being lightened on those frontline apparatus. We will also be following up with patient outcomes, referred medical assistance for statistics and patient outcome. We are also going to be counting the time spent that the community paramedic unit spends helping the patients every day with those pre-scheduled things. We'll be tracked to collect data in regards to account for non-emergency 911 activations not made because of the paramedic unit. So basically, when they have an appointment with those the program applicants and members, we're going to count that with a weighted grade, or conversion, I should say, but it is essentially freeing up apparatus and not having those community members call 911 as a default. So we are saving call volume that way as well. Moving on to the next slide, expectations, projected outcome. So out of the 7,826 EMS calls taken by the department in 2024, 64%, roughly 5,008, were geriatric patients. So the first year, we expect the community paramedic unit to take around 750 calls, which would be just shy of a 10.5% total EMS calls the department takes. So that's a 10% reduction in overall EMS calls. This would significantly reduce the wear and tear that our frontline medic units are taking, and this doesn't account for the 911 calls not made because of the program. Like I said, we'll be tracking that, and there will be a conversion factor to try and justify the calls that would not have been made, but this is just on top of it, so it's overall helping us. I did have a quote from the CDC that I'll list here the limited research suggests that community paramedic programs can be cost-saving to the healthcare system, primarily through fewer 911 calls, emergency department visits, reduced acute care utilization, reduction in hospitalizations and hospital readmissions, with reduced healthcare costs associated with medically unnecessary ambulance transports, ED visits, and hospitalizations. Basically, what that quote is saying is this community paramedic program works great for the American healthcare system and reducing non-emergency visits and costs. Moving on to the next slide, what's the future? So the future of EMS is under the community paramedic model. That's where we're going to be going. It's scary because it's change. I'm a fireman. I don't like change. I get it. But this is the way of the future, and this is the way that healthcare is headed. So we need to really adjust and get the ball rolling sooner rather than later for this. So the program's success will lead to more funding. I guarantee this program will be a success and help alleviate some of the call volume that our units are taking and free up resources for the community. The goal of the program is to expand it past senior citizens to those who need and with specific criteria. We want to open that up But right now, we have such a large amount of senior citizens that they're the ones that are in most need. But once this program is justified to the township and we can show them the cold hard facts and statistics of the money and wear and tear they're saving on apparatus, then we can expand and get more additional funding to accommodate those people. The hardest part of the program is the initial investment. It's a hard pill to swallow. It's more money. We're asking for more money, and that's always frustrating to the township because we are the most expensive department that they pay for. But like I said, it's worth the investment. It's going to help save the department money, time, resources, and it's also going to be bettering the outcomes and really helping the senior citizen community within the township. Moving on, the impact of a community paramedic. This is a quote from a local paramedic that's been operating in the area. So, when a serious health problem happens, you go to the hospital. However, some of the biggest challenges patients face happen after being treated and once they leave. A lot of times when you get discharged from the emergency room, you're getting overwhelmed. Everything's being thrown at you, including no medications, no instructions, just everything. Elderly people especially will get home and question what just happened and what now. I can be that person to go out and talk them through that, help them understand what they need to do, and ultimately reduce those repeat emergency room visits. That's from Cheryl Ware's, one of the ministry's community paramedicine program in the local area. So basically what that quote is saying is the American healthcare system is complex. It is not easy, and especially for our senior citizens, it can be overwhelming, especially if they don't have a support system, which a lot of them unfortunately do. So we are there to help guide them and shine a spotlight on where they need to go, what they need to do, and we're going to help give them the resources and tools to help get them through the healthcare system the way that they should be treated, with respect, dignity, and not have to rely on 911 emergency services to get the help that they need, especially when it's not emergent. Moving on to the next slide, summary. So senior citizens make up a significant portion of the township, as well as a large portion of our patient demographics. We need to better serve them. We can't just rely on them calling 911 and dropping them off in an emergency room where they get discharged with paperwork that they are unfamiliar with. It doesn't help them. This program is going to reduce 911 calls, reduce our frontline medic units' wear and tear, free them up for other calls, and it's going to help our senior citizens navigate the complex healthcare system and get the help that they need. And it will be also a very productive service to the community. We owe it to our elders, and we owe it to our community to make sure that they are not just medically treated, but taken good care of as people. That is what this exciting program is all about. We're here to help them, we're here to make their life easier, and we're here to help them navigate the complexities of the healthcare system and get treated the way that they need to. And the last slide is references. That's all I had. Thank you very much for your time. I hope you didn't fall asleep. But I will be submitting this. If you have any questions, just reach out and I will get it done. Thank you. You have a good day.